Hello, and thank you for joining me today for the Impact of Cerumen. Today, we take a journey into the ear-illuminating topic of earwax, also known as cerumen. I hope to open your eyes and ears to the anatomy, location, and importance of earwax, what happens when earwax becomes a problem, and what treatments are currently available. Let's start off by taking a look at where earwax is found and where it comes from. No surprise here, but earwax is found in the outer part of the ear canal, or pinna, leading to the ear canal, which eventually runs into the tympanic membrane, or eardrum. Earwax is found in the outer part of the ear canal, and if we take a little closer look at the anatomy of the ear canal, we can see that earwax is actually formed from the combination of two secretory glands called the ceruminous glands and the sebaceous glands. The oil from the sebaceous gland combines with the ceruminous gland to form the waxy substance we all know near and dear as earwax. So, why do we have this substance in our ears? And what exactly is the purpose? Well, earwax is a beneficial substance that acts as our ear's shield or defense to the outside world. So, let's introduce you now to the star of the show, the earwax knight of the tympanic membrane, cerumen. Now, cerumen is a noble knight, and he is endowed with the protective and helpful duties that he must fulfill in order to keep his job. So in addition to acting as a lubricating mechanism for the ear canal, without this mechanism, the ear canal can be dry and itchy. Cerumen helps cleanse the ear of old cell debris, dust, and other particles that would collect and have nowhere to go if cerumen didn't clear a pathway to the outer ear, which is oftentimes assisted or sped along with increased jaw movement. So people that talk frequently or chew gum may notice an increased outward appearance of cerumen, but do not fret, as cerumen also has an antibacterial effect. By not only trapping would-be pathogens, he helps acidify the environment of the ear canal, making it an unpleasant place for bacteria to want to settle down in. So when does earwax become a problem? Well, if the self-cleaning function of earwax is disturbed or disrupted, then accumulation and buildup can become bothersome and lead to an impaction and/or occlusion of the ear canal or eardrum. Cerumen impaction affects about 10% of the pediatric population and remains a popular question among parents, which is why you should seek out medical attention if you notice hearing loss, ear pain, itching, tinnitus, odor, a sensation of fullness in the ear, any drainage or dizziness, as all of these can be signs and/or symptoms associated with cerumen impaction. So, how do we remove earwax when it is a problem? First, let's take a look at ear candles, also known as ear coning, or even more technically, thermoauricular therapy. The ear candle is a hollow tube of fabric coated most oftentimes with beeswax. The patient lies on their side with the affected ear facing the ceiling. The ear candle is placed gently into the ear canal, and the end farthest away from the ear is lit with a match and allowed to burn down until about 3 inches of the ear candle remains. The process usually takes around 15 minutes to complete. The ear candle is thought to work because the fire's heat melts the wax inside the ear. A second thought is that there is a chimney effect, which allows a changing in pressure to force the melted earwax from the ear canal into the ear candle via suction, or what is also known as negative pressure effect. So let's take a look at the available literature. Seeley et al. In Ear Candles, Efficacy and Safety investigated the impact of ear candles in cerumen removal. The investigators created an ear canal model from plexiglass with an outer plastic membrane in order to obtain a tight seal for the ear canal model and placed a tympanometer in the lower part of the ear canal where the ear candle would be in order to measure pressure changes. The candle was allowed to burn until 2 inches of the candle remained. 20 ear candles from 2 different manufacturers were tested. The tympanometer did not record any instances of negative pressure. 8 ears, 4 with cerumen impaction and 4 without, were also subjected to ear candle trials, with the ear candle being burned until about 3 inches of the candle remained. Pictures were taken of the ear before and after ear candling through otoscopic examination and a camera attached to it. Patients with cerumen impaction had no visual decrease in cerumen buildup. Candle wax deposits, however, were seen in 2 of the 4 unimpacted ears after candling. In the latest clinical practice guideline for cerumen impaction, the subject of ear candling is also addressed by Schwartz et al. In a review of 3 guidelines, 5 systematic reviews, and 6 randomized control trials, no evidence was found that ear candles have any impact on the removal of cerumen. I could not find a single trial that showed any removal of earwax from the ear canal based on my PubMed search. So this is a great opportunity to look beyond the scientific description used to market the candles and use our own thought process as to the safety of this product. If you think about earwax being in the ear canal, in order to melt the wax, the outer part of the ear would have to get hot before the earwax would be affected. How safe does that sound? Additionally, if the wax did somehow melt, it would go all the way down to the eardrum. Safety is the largest concern, as the byproduct of the burned candle does go into the ear canal, and the patient has to deal with the hazards of an open flame. So where does this leave us if we want to remove earwax in a single session? Well, that's exactly what Shope et al. Looked at in a randomized trial of irrigation and curetting for cerumen removal in young children. At the Children's Hospital of Pittsburgh Primary Care Center, children aged 6 months to 6 years of age were recruited from June of 2016 until August of 2016, which included a total of 59 ears. Inclusion criteria, aside from the age, also included cerumen inclusion greater than or equal to 25% of one tympanic membrane as noticed by otoscopic examination. Children were excluded on the basis of otorrhea, hearing aids, history of tympanic membrane perforation, and if they've had ear tubes or otitis externa in the past 2 weeks. The 59 ears of the patients were randomized into one of 4 treatment groups, the first one being a 60 ml syringe with angiocath tubing, the second being the elephant ear washer bottle system, the third being the Odo Clear spray wash kit, and the fourth being a metal curette. All of these were used with saline solution, as previous trials have shown pre-treating with Cerumenolytics have not shown to be any more effective. The primary outcome for this study was to see if there was a decrease in cerumen occlusion. There were no statistically significant differences among the devices. If you look at the syringe with angiocath at about 43%, the elephant ear at about 64%, the Odo Clear at 71%, and then the metal curette at about 65%. We had a p-value of 0.67, which was not statistically significant. Power was met as they needed at least 59 ears, which they did meet, and then procedures were most often stopped due to parental request, which could alter the final cerumen removal results. In the end, while cerumen impaction remains a main concern for parents and healthcare professionals alike. The available treatments are only moderately effective at best. The current therapies still do not show any better efficacy than saline for a single treatment regardless of the device used for irrigation, which means we need to find more efficacious treatments that are both safe and timely for our pediatric population. Current studies are looking at therapies that incorporate multiple ingredients to target different mechanisms for removing earwax buildup. For example, one study is looking at using a bicarbonate solution with glycolic acid in order to target two areas of cerumen, to break down the bonds and structure of cerumen and to weaken the cell adhesion molecules. Here is the list of references used for the creation of this presentation, and I hope that this taught you a little bit more about earwax, what it is, and what to do if there are any problems. In the detail sections of this video, you'll find a list of self-assessment questions with a written transcript and typed out list of references. If you have any questions, please feel free to leave a reply. Thank you, and have a wonderful day.